Good afternoon, Nancy. Hello, everyone. Welcome to our next series for the Nathan Lee Foundation. We are going to be doing thyroid, how to read and why you would get thyroid tested for your thyroid. So Nancy's going to bring us through that process today and give us some valuable information on the tests that your doctor may perform and how to read those tests and what they actually mean and what they're looking for as part of that test.
And it's interesting because I think this is a much overlooked test, a much ignored test a lot of times. And the diagnosis of thyroid challenges goes undiagnosed for a while till it gets significantly bad. And so that happened to me. So I have a little bit of history backstory here. I was diagnosed with hypothyroidism when I was 16 and put on a very low dose. I was in that range of going there. So my doctor at the time just said, hey, we're going to put you on Thyrolar, which is porcine or from pigs, and it's T3 and T4, which I'll explain in a little bit. And I was on it until I became pregnant, which is typical. And then my thyroid kicked back in and I didn't have to have any type of medication until I hit menopause. So, but I was misdiagnosed when I hit menopause. I didn't think about the thyroid issues, the hypothyroidism, when I went into menopause early. So they just treated me with estrogen. And all I did was gain weight. I was still feeling crummy, and all it did was make me gain weight. It didn't make me feel any better, and it was the horse urine estrogen, which is a tough Premarin, pregnant mare urine, Premarin. So when I told my doctor, I go, I want to get off of this. You got to test my thyroid because I'm thinking that this is not just it. Well, I was in deep hypothyroidism. So they put me on Synthroid rather than the Thyrolar, which is just T4. And it worked. It did the trick, sort of. And we were always adjusting it. But when I went off the Premarin, this is another video. When I went off the Premarin, my doctor said, no, you can't, you stay on it. And I'm like, no, I don't want to stay on it. It's pregnant mare urine. So I knew I had to taper myself off. So I had these capsules. When I broke the capsules in half to taper myself off to go to half and then half again and then gone. The pill bottle smelled like a barn.
Oh, lovely.
And I mean, you guaranteed I never went near Premarin again. Just the concept of, and it does work for some people. It's hormone replacement therapy, which is dangerous, I think. My mom got cancer from that. And so I wasn't real enamored with being on it anyway. But that just is, when you think about where medications come from. So I was on the Synthroid until about 6 months ago. And finally, I was not feeling good, and we were going up and down as my weight would fluctuate 5 or 10 pounds in either direction. I could never really lose the weight I wanted to lose. I just said, I want to go back on Thyrolar. It's T3, T4. It's the two hormones. And I feel great. So that's all I can tell you. I feel great 15 pounds later. I have lost, and I feel good. I have the energy that I remember. So what is a thyroid? Why does this happen? Your thyroid is the engine to your body. It is what makes it's the hormone that makes your body function, makes everything else function well. So the TSH, you tested, the thyroid panel is typically TSH, T4, and T3, pre-T4 and T3. TSH is thyroid stimulating hormone. It's produced by the pituitary gland, and it stimulates your thyroid to produce T3 and T4. T4, which is thyroxine, is produced by the thyroid gland. It regulates your metabolism, your body temperature, growth, and energy usage. There are bound and unbound forms. Free T4 is the most clinically relevant one, and it indicates the active usable hormone in the body, in circulation. T3, which is triiodothyronine, is produced by conversion from T4 primarily and the thyroid gland directly to a lesser extent. It's biologically active and more potent than T4. It directly regulates your metabolism. So you can see there why Synthroid for me was just T4 and I needed the T3. And if you talk to people, if you look up Armored Thyrolar, you'll see people saying they have more energy with this and they rarely go back to Synthroid. But it's the T3 that is so important. Again, there's free T3 and bound T3. And again, the free is the active form available for use in the body. And it's interesting. So when you get your results, your TSH is the thing that shows how hard your body is trying to make the T3 and T4. And if your TSH is high, that means that it's really trying really hard and you're more than likely have low levels of T3 and T4 and you're hypothyroid. And I'll throw some charts up here to show you how that all works out.
Here's a question. How do you know what are the symptoms other than gaining weight? And I'm thinking, yep, that must be why I'm gaining weight. It can't be those chips I put in my mouth. I mean, how do you know when to say to your doctor, please test me for this?
All right. So the typical, and I will have all of this in the description for the video, all of the links that you can read in detail. Fatigue, weight gain, being very sensitive to temperature. Hypothyroid, you're very sensitive to cold. Joint and muscle pain. I mean, since I do have a level of osteoarthritis, and I got it from my dad, and my discomfort has reduced dramatically since taking the Thyrolar, and having to do again with T3. Dry skin, thinning hair. So I was joking, my hair is so long now, and it never would grow this long. Heavy or irregular menstrual periods for women, and that is something I struggled with, and that's probably why my doctor at 16 put me on, or I identified the hypothyroidism at that point. Fertility problems, and it's a challenge because miscarriages can occur because of the low level of hormones, which that happened to me too. Depression and constipation. I mean, those are, and even the flip side of diarrhea with that for hyperthyroid. So a lot of these are hypothyroid, which is the more typical condition where your thyroid's not producing. And there's a couple of reasons why, and I'll go through that in a little bit.
I mean, it's low. It's too low.
Hypo okay. Is low. Hypo is under, like hypodermic goes under your skin. Hypothyroid. And the hyper is, hyperactive thyroid, which that's a rough one. And I went through that. Because of my thyroid medication being too much. And that was an ugly scenario. Anybody who has the malignant hyperthyroid condition, and I say malignant, not necessarily cancer, but it can be.
Chronic.
It's a hyper production of your thyroid hormones, and that no sleep. It was just, I don't want to get into the details, but it was rough. I I didn't really lose weight as much as I just couldn't keep anything in. And I mean, it's interesting. So some of the conditions that exist based on your thyroid function, increase in function or decrease in function. There's thyroiditis first and foremost, and hyperthyroid and hypothyroid describe the function, but what are the actual diagnosis that you could get? So one is thyroiditis. It's an inflammation of the thyroid gland, and it can lead to over or underproduction of the thyroid hormone. So it can go either way. And it has like a phase to it. There's the thyrotoxic phase where the thyroid's inflamed and releases too many hormones, causing temporary thyrotoxicosis. And so I actually had the goiter. It's called a goiter. This is when I finally figured out that it was not menopause. I was artificially thrown into menopause. But it's swelling right here.
And that's why doctors check your neck every time you go to the doctor's
office. Because they'll feel your thyroid, right? And my gynecologist wasn't looking up there. And so then there's also the hypothyroid phase, which follows the excessive release of the thyroid hormones for a few weeks or months. Then your thyroid doesn't have enough to release. So you go down the hill to hypothyroid. And Hashimoto's, which I'll talk about a little bit later, is autoimmune, which I'm pretty sure that's what I have. And then there's the euthyroid phase, which while you're going from this crazy phase down to nothing, there's a euthyroid, which is a normal phase. Your hormone levels are normal for a while, but not very long. Then you drop into the hypothyroid. So different types of thyroiditis are Hashimoto's. And this is an autoimmune condition. It's also called chronic lymphocytic thyroiditis. It's caused by antithyroid antibodies. It's the most common form of thyroiditis and the most common cause of hypothyroidism. Now, I don't know about the genetic aspects of this, but my mom had this, I have this, and my daughter has this. There's also silent or painless thyroiditis. That's an autoimmune condition caused by antithyroid antibodies. Postpartum thyroiditis, an autoimmune condition caused by antithyroid antibodies that can occur 1 year after giving birth.
Does it happen anytime after you give birth, or is it like it'll pop up a year after you give birth?
Within a year after giving
Within
birth.
a year.
Because
okay.
When you're pregnant,
The
autoimmune diseases, though, typically are at bay because your body's immune system is slightly lowered when you're pregnant to protect the baby.
Right.
So a lot of autoimmune diseases lessen in intensity, and then boom, as soon as you give birth, you're back into your hypothyroidism or your thyroiditis, which if it's autoimmune, that's going to happen. Didn't happen with me until I hit menopause. I'm not sure what that was, the chicken or the egg, with regards to menopause and hypothyroidism. And you can see how they're all your hormones are dependent on this. So you really want to know the condition of your thyroid. And I just think they should be doing that as a screen at all the time when
blood test.
Yeah, they should be. So there's radiation-induced thyroiditis. This is a condition caused by radiation therapy used as a medical treatment for certain cancers, or radioactive iodine used to treat hyperthyroidism. So hyperthyroidism, they inject radioactive iodine, or you take it, and it negatively impacts your thyroid. Subacute thyroiditis, or de Quervain's thyroiditis, it's a painful condition thought to be caused by a virus. It's usually preceded by upper respiratory infections. I do know somebody that had this back in the lab. One of our colleagues who ran the serology department, she actually had a virus attack her thyroid, and it was rough for a while.
That's not,
Acute infect. Hmm?
that's not good. That's
No,
not
no,
good.
because when a virus attacks anything in your body, it's so hard to regulate. I had one that attacked my adrenal glands and my pancreas, and I was shooting out insulin randomly. Like it was hard to function because I'd go into low blood sugar attack randomly without any regard to what I ate when I ate. And then the adrenal glands, my heart would start to pound. It would feel like I stuck my finger in an electrical socket. But once the virus is gone, all those symptoms went away. In acute infectious thyroiditis, which is rare, and it's caused by an infectious organism or bacterium, not specifically virally induced. And drug-induced thyroiditis, use of medications such as amiodarone, and that's for AFib, interferons, lithium, and cytokines. It's a rare side effect of those drugs. Rydell's thyroiditis. It's a rare disease caused by acute or chronic inflammation and fibrosis of the thyroid gland. And fibrosis is a thickening or scarring of tissue. No specific causative agent for it. Graves' disease. And it's an autoimmune disease that affects the thyroid gland. The gland produces too much thyroid and causes hyperthyroidism. It's the most common cause of hyperthyroidism, and it's named after Robert Graves, an Irish doctor who first described the condition in the 1800s. You're more likely to develop Graves' disease if you have other autoimmune diseases like rheumatoid arthritis, lupus, celiac disease. And it accounts for 60 to 80% of hyperthyroid cases. So hyperthyroidism only affects 1.2% of the people in the country. So it's not real common. Whereas I think it's like 1 in 5 have hypo. So in Graves' disease, it can affect your heart, your skeletal muscles, your eyes, your skin, your bones, and your liver. So while hypo affects your engine, hyper is going to directly affect your working body. It can lead to rapid heartbeat, heart conditions that can cause osteoporosis, which is a lack of calcium in your bones, weakened bones. It's very pathogenic. Symptoms of Graves are gradual, taking several weeks or months to develop. And so you don't really notice it until it gets to that point where it's uncomfortable, like the rapid heartbeat or palpitations, feeling shaky or nervous. Weight loss, at first it might be a cool thing, and then all of a sudden it's not. Increased appetite, diarrhea or frequent bowel movements. That doesn't go away, and it becomes, when I experienced the hyperthyroid, it was pretty bad. And I couldn't figure out what was going on. Kind of scary. Thin, warm, and moist skin, having nothing to do with age. I get that, and
I was thinking the same thing.
age is an awful thing. So, and inevitable. Intolerance to heat and excessive sweating, difficulty sleeping and insomnia. You do have an enlarged thyroid gland also, and hair loss and change in hair texture, which is interesting. You would think that with more hormones, your hair would be great and your nails would be great, but it actually kind of goes to the other side, causes hair loss and brittle hair texture, and menstrual changes and muscle weakness. So there's also a tangent to Graves' disease. And I think there's a commercial right now for one of the pharmaceuticals that treats the eye problem with Graves. It's gritty, irritated eyes, swelling of tissue around your eyes, puffy eyes, bulging eyes, light sensitivity, pressure or pain in your eyes. and blurred or double vision. It's Graves' ophthalmopathy. So that's a mouthful.
Do that again.
Or thyroid eye disease, TED. The commercial talks about TED, and well, about a third of the people with Graves' disease have TED. And you think about if 1.2% of the population has hyperthyroidism or Graves' disease, then 1/3 of that, it's not that common. It's uncommon. They can also get something called pretibial myxedema, which is like a painless and mild thickening of the skin on the shins of your leg. That's kind of interesting. They don't know what causes the autoimmune reaction. Something triggers the immune system to overproduce an antibody called thyroid stimulating immune globulin, TSI. And it attaches to healthy thyroid cells, causing your thyroid to overproduce thyroid hormones. They do know that an attack can be stimulated by stress, a viral infection, or pregnancy. So it's a very interesting, well, not common. It's a very interesting, and treating it, they use beta blockers, anti-thyroid medications, radioiodine therapy, which is taking 1 dose of radioactive iodine in pill or liquid form over 2 to 3 months. Radiation slowly destroys thyroid glands. The rest of your body is not exposed to radiation, although I do know there's a treatment that does like inject or place radioactive material in the thyroid, where you have to be somewhere else away from people for a day or two. That's
I've
probably
noticed when I've got, sorry, I didn't interrupt. I noticed when you go to like get an x-ray done, they're very diligent about putting that shield across your neck and around there to protect your thyroid. And if they're doing x-rays and they anywhere near your upper body and they're not doing that, I'd be a little concerned.
well, it's interesting because when people go to the dentist and they get their yearly,
Yes.
always ask for that collar, because I literally canceled my last dentist appointment. The collar broke and we don't have it. I go, I'm not going to do that. I'm not going to expose my thyroid to your radiation. No,
Right.
not even. So there's a lot about Graves' disease that you can look up. My link in the description is to Cleveland Clinic. They have a very good explanation of Graves' disease, but it's just not that common.
They're a great resource in general for a lot of information.
Yeah, they are good. And we try to make sure that every bit of information that we refer you to is credible, very credible information. I flipped back to Hashimoto's, which is interesting. What are the risk factors for Hashimoto's? And this is the hypothyroid. This is the low thyroid one. Family history research suggests that your genetics account for about 80% of your likelihood of developing Hashimoto's. So yeah, I guess my mom, me, and my daughter. Females are 10 times more likely to get Hashimoto's. And that, again, that's pretty interesting. You're more likely to get Hashimoto's if you have other autoimmune conditions like Addison's, celiac, lupus, pernicious anemia, rheumatoid arthritis, Sjogren's syndrome, and excuse me, type 1 diabetes. So there's quite a bit here. There's a lot of different treatments for hypothyroidism, the Hashimoto's type. And I'll have a list in the discussion. They don't mention Armour Thyrolar, which I'm surprised, because that is the one with the T3 and T4. And most of the synthetic manufacturers just do the T4 hormone, and it is synthetic. The Armour Thyrolar is from pigs. It is a natural occurring T3 and T4. which is, I mean, it's very interesting. So when when you do get treated, you do have to make sure that you are getting tested. Your TSH and T3 and T4 are tested routinely. Like since I switched, I've probably been tested 3 times in the last 6 or 7 months because we want to make sure that I'm on the right dose and everything is moving the way it should. And it's very important that you stick with that. If you don't, hypothyroidism can lead to high cholesterol, heart disease and heart failure, high blood pressure, and depression. So a lot of these things, when you go in for high blood pressure, high cholesterol, you should get your TSH checked and your T3 and T4. And if you see that it's not in the list, then you can ask your doctor for it, and never ever think that you can't ask your doctor to do a test. And if
And
they
these are
ask you
relatively
why,
inexpensive tests too. I
that's
mean,
it.
they're not expensive tests.
No, I think one of the links I have is to Quest, and I think it's around $90 for the whole thing, the
Right.
T3,
Panel.
T4, and TSH. But it's an interesting, it's just an interesting test, and it's an interesting condition because it just goes out to all these other things like high cholesterol. And I truthfully, my cholesterol is high, but I have a lot of HDLs. But I haven't been tested, and I'll make sure that I put an addendum to this when I do eventually get my lipid profile, which we're going to be talking about that next in our next video, to see if my cholesterol dropped at all, because my waistline has dropped by at least 2 inches, and that's the one
I'm
of the.
jealous.
Pardon me.
I'm jealous.
But like everyone's going to go out and get their TSH done and ask
right.
where viral are, because that didn't happen with the T4, with just the T4. It was the T3 and T4 for me anyway. That's just my opinion. That's not a medical diagnosis or anything like that. It just worked for me. So that's pretty much it with regards to your thyroid profile. I highly suggest, again, if it's not tested by your doctor, ask for it.
So I have a question.
Yeah.
So my doctor tests for TSH and it came back normal. Should I still ask for the T4 and T3, or just assume that it's good based on the TSH?
So that's a good question. And I say that's a good question because I've got notes in front of me, of course. There is a level of thyroid challenge that is it's not way high results or way low results. It's sort of in between. And it's like my doctor back when I was 16 knew my mom had this, and my thyroid levels were, my TSH was not way high, but it was above 4. So you go from 2 to like 12. I think that's it. And people on thyroxine or on T3 and T4 like me, it should be down around 2 TSH. If it goes above 4, then you're trending towards hypothyroidism. And it's called subclinical hypothyroidism, where your TSH is mildly high and your T4 and T3 levels are normal. You're having thyroid dysfunction, but you're not showing any symptoms. So absolutely keep an eye on your results and talk about this with your doctor. Don't hesitate. Subclinical hyperthyroidism is mildly low TSH, and your T3 and T4 are normal. So your conversations with your doctor are really important, because if you're having some of these symptoms and there's no real abnormality out there that's causing it, not viral, like especially the fatigue and the thinning hair and menstrual problems, talk to your doctor, discuss the results, say, look, this is mild. This looks mild, but I'm kind of high with the TSH. Can we try a low dose
My TSH was low, borderline low. It was
Okay.
still green, but it was on the lower end
And
of the
it's
scale. It's
yours.
still within acceptable parameters.
Yeah, yours was down there around 2.
Mhm.
So 2 to 3. But when you start inching up over 4, then you're and one of the things we did do was look at your trends. So
Right.
today, this is really nice. Today, you can go onto my chart or whatever you're using, your physician is using. You can go onto your digital app and
Portal.
see that trend over time to see if it's starting to inch up, 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 up. And that's another way to figure out, say, hey, put me on a low dose and see if this does the deed, right? But always have that conversation with your clinician because they're more than willing to talk to you about it. And again, we're not diagnosing. We're just giving you information that can help you talk with your clinician for sure. Any other questions, Diane?
No, this was good, Nancy. Thank you so much.
So don't forget to like us and subscribe. And we'll see you next time for the cardiac panel.